One other question real quick on this slide, number 5. I mean, talk about the utility of closing things when we only represent, you know, half of those businesses in the metro, and there are so many interior suburbs that would not be affected by our actions and would still have those same types of activities ongoing and available to the public.
If I could back up, Johnny, if you can take me back to the pie graph and let's look at that for a second. So that was really born out of this chart right here, this graph and this pie. Because when we're looking at, if you add restaurants and bars together collectively, you know, right there, you're looking at 30 something out of this entire pie chart. And so it's, as you know, extremely complicated if you picked a group such as faith-based activities. So ours came from literally trying to find a place where people were gathered indoors. They were largely unmasked. And so that's why we believe that that's happening in those settings. To your point, I understand is a point that you've made many times. If certain cities or certain counties do something and then the neighboring city, so maybe a business is absolutely just across the street and they have not enacted that same ordinance, then it is kind of a failure. But even if we chose it as a way to lead the other municipalities, other cities, and other counties, I mean, it's still something that we would recommend simply because of the number of people that are impacted and the potential lives saved.
Okay.
Yes, and also Dr. Retzkoff would like to address that as well. Mr. Mayor, if that's okay?
Of course.
Yeah, thank you, Mayor. It's a great question. I think what we have to remember is that no intervention will be 100% effective. The second thing is that we already, as Dr. McGough presented, are seeing some encouraging results, preliminary but encouraging, just from your order of a reduced 50% capacity. So it appears to be having some impact. And the reason that we focused on this is that this is largely an area where we can't mask people. You can't keep your mask on while you eat your dinner. And that's the thing. And I have personal experience with this, and I would be happy to share that other times with family members and friends at a restaurant in February. Now, I think it's important, I would like to mention for the council that we consider very significantly the impact of this on those businesses, of course. And I think this is a point where CARES funding could be more effectively used. And I understand there's some issues of the interpretation and what you can use it for and all that. But if we had a program where by monitoring what's going on through the contact tracing, and you've talked about a 2-year time frame, where we see spikes like this, we might have temporary or intermittent reductions, and then we support those by providing CARES funding to help those businesses with the cost of staying open and paying their employees. So that kind of thing, if we can link those type of ideas, I think it would be effective. Sorry, Blaine, that podium is kind of... Okay. But I think the crucial thing is, you know, if you're in a restaurant, I'm not doing this every time I take a bite. And I think you're sitting close. Now, they've distanced and all of that, but I think it's clear that's representing 24%. And then you add the bars, it's a third of the total transmission. General masking, if people get on board with general masking, will cover almost all the other areas.
Mayor Holt, also one of your favorite people, Hermila Haile, would like to talk a little bit about the bars and restaurants as well.
Okay, sure.
Okay. Yes. Okay. Stand at the podium, it's missing.
And just to add about the issues with the bars and restaurants, these settings are the most difficult places for us to do contact tracing, primarily because we will know what staff members were there who are potentially exposed. But when it comes to patrons, there's no attendance sheet. We're not really sure who exactly were there unless we have a multitude of folks who come to us through our contact investigations and mention this bar. So oftentimes we can't do the additional follow-up to identify other patrons and other exposures in these settings. So that's another reason why we should focus on them as well. Thank you.
They also mentioned about they don't go to one bar.
Also, we have several instances where people are bar hopping, going to more than 2 or 3 bars in one evening. And we'll be lucky enough if they know the actual names of places or where exactly, or the days and times for this type of exposure. So in these settings, it's extremely difficult for us to do our basic contact tracing. Thank you.